friends, today we are going to learn the hip joint. So, hip joint is a synovial joint and its type is ball and socket. And it is very important that it is the largest ball and socket joint of our body. So, let's know the articular surface. So, here in the hip joint, the head of the femur acts as a ball and the acetabulum of the pelvic bone act as a socket and they both form the ball and socket joint. Now let's come to the ligaments. These ligaments give stability to the hip joint. So the ligaments are fibrous or capsular ligament. So you can see that the capsular ligament is common in most of the joints of our body. Then it's very easy to remember the next three joints, which are the iliofemoral, pubofemoral, and ischiofemoral joint. So here these three ligaments are formed by attaching from the femur to the ilium part, the pubis part, and the ischium part of the hip bone. And these three ligaments provides also stability. Then come to the round ligament of the head of the femur. It's also a ligament which is attached in the articular part of the femur. And the last ligament is the transverse acetabular ligament. So here you can see this is the acetabulum of the hip bone. That means the femur, head of the femur attaches here. So it's actually a horseshoe shaped part, and this transverse acetabular ligament makes it a complete circle. So it helps to make the acetabulum more stable. So now the transverse acetabular ligament. So here you can see the acetabulum is horseshoe shaped. So to make the acetabulum round shaped, the transverse ligament attaches between these two parts of the horseshoe shaped cartilages of the acetabulum. So in the round part, the head of the femur attaches here. Now there are some factors which give stability to the hip joint. These are the depth of the acetabulum. So the more the depth of the acetabulum is, the more the stability the hip joint gets. That's due to the same reason the hip joint is more stable than the shoulder joint, because here the depth of the acetabulum is more than the depth of the glenoid cavity of the scapula. Next come to the strength of the ligaments and muscles. So it's very obvious that the more powerful the ligaments and muscles are, more stable will be the hip joint. And atmospheric pressure, which gives stability to all joints of our body. Now let's talk about the relations of the hip joint. Now see the diagram. It's a diagram which is formed by a longitudinal section of the hip joint. So if you get a longitudinal cut in the hip joint part, you can see diagram like this. So this is the hip joint. In the back side, as you know, the gluteus muscles forms the back. That is the gluteus maximus, that is gluteus medius, and gluteus minimus. And also the piriformis, obturator internus, quadratus femoris, biceps femoris, which you all know are present in the back side of our thigh. And in the front side, you all know that the gracilis and the adductor compartment, and in the upper part these muscles are present, and these yellow things are the nerves of the hip joint. So let's see. So in the anterior part, as you can see here, the femoral nerve, vein, artery are present. This is the femoral nerve, femoral artery, and femoral vein. Then there is a tendon of iliopsoas. As you can see, it's present here. In the posterior part, as I have said just now, that gluteus maximus forms the back part with piriformis, and as you all know that sciatic nerve is present at the back of our thigh. So the sciatic nerve, obturator internus, and quadratus femoris, as you can see in the back side. So if you can make this diagram beautifully, you can just write these relations very easily from the diagram. And in the superior part, as you can see, the gluteus medius and gluteus minimus presents along with the rectus femoris. So here you need to notice that this is the rectus femoris muscles, and there are two parts of the rectus femoris. One is the reflected part of the rectus femoris, and this is the straight head of the rectus femoris. Now come to the inferior part of the hip joint. So the adductor compartment, all the adductor muscles are present in the inferior part. That's are adductor magnus, adductor brevis, and adductor longus, and also the obturator externus, as you can see here. Now let's come to the blood supply, because you all know every part of our body is supplied by some arteries, and in the case of hip joint, the arteries are obturator artery, the circumflex femoral artery, and it has two parts, the medial and lateral. Circumflex means that it surrounds along the femoral bone, and it's very easy to remember here, because obviously the femur is forming the hip joint, so it's the circumflex femoral artery and the superior gluteal artery, and we along with the inferior gluteal artery. So these arteries are supplying the hip joint, and in the nerves which are supplying the hip joint are the femoral nerve, the anterior division of the obturator, nerve to quadratus femoris, and superior gluteal. If you can remember this much of the hip joint, and if you can draw this diagram, you are very good to go for your exam. Thanks for watching.